Well, joining me now is Dr Tahlia Scheinberg, medical oncologist specialising in prostate cancer at Chris O'Brien Lifehouse. Thanks so much for your time, Doctor. From what we know, and of course we haven't seen the medical records, I assume you haven't either, Doctor. We know from what the Biden family have told us, it's an aggressive form of prostate cancer. It has metastasised to the bones. How serious is that?
Look, any diagnosis of cancer is serious. And in this case, once the prostate cancer has spread beyond the prostate itself and has settled in the bones, it is no longer curable. So that means that any treatment that Professor Biden will receive is aimed at trying to improve his quality of life and keep him alive for longer. Now, prostate cancer is very hormonally driven. It's driven by testosterone. And so I would imagine that Professor Biden will be recommended to start treatment to block the ability of testosterone to be produced by the body, and also for the ability of the testosterone to bind to the testosterone receptors on the prostate cancer cells.
Right, so how does hormone treatment actually work? Is it just stopping all testosterone?
So there's different options for hormone treatment. The backbone of treatment is often androgen deprivation therapy, and that is an injection that is administered to block the production of testosterone from the body. We also often use tablet hormonal therapies, and those hormones, that treatment works to block the ability of any residual testosterone to bind to the testosterone receptor.
This looks to be a very aggressive form of cancer. It has metastasised to the bones, as we've discussed. In general, I know it's hard to generalise when it comes to cancer, but how quickly can this progress from prostate into other areas of the body usually?
It's impossible to know is the answer, and it's impossible to know how long this prostate cancer has been there. In saying that, though, of all of the different types of cancers that there are, prostate cancer is usually one of the more slow-growing. Okay. In saying that, Professor Biden's is one of the more aggressive forms, so all the way at Gleason 9 or grade group 5 disease. So it's probably within the spectrum of prostate cancers, a more rapidly growing cancer. But this is not something that developed yesterday. This is something that's been present for months, if not longer.
Yes. So this gives us an opportunity to remind people that they should be aware of the symptoms. What are the symptoms of prostate cancer? What should you be looking out for first?
So there would be symptoms from the disease in the prostate itself, as well as symptoms to do with where it has spread to. So symptoms to do with the prostate would be urinary symptoms. So needing to go to the toilet more frequently to pass urine, and needing to urgently rush to go to the toilet to do so, needing to get up at night frequently. Obviously, these are very non-specific symptoms, and as men get older, it can be a normal part of the aging process, but if you have any concerns, it's important to see your GP. And then the urine is something that you need to see your GP more urgently for. And then some of the symptoms of once the disease has progressed and has spread outside the prostate might be things like pain in the bones, weight loss, and it can also present with a fracture in a bone.
Right, okay, so he would have a lot of symptoms, that pain in the bone. Is there an age range for this? Obviously, Joe Biden is in his 80s. Is this something that younger men should keep an eye out for in particular, though? What's the kind of the danger zone?
Yeah, so prostate cancer is something that happens more commonly as men get older. The most common risk factors for prostate cancer are being male and having, and as you increase in age. So the most common symptoms would be as people get up beyond their 60s, 70s. But this can present at any age, and you shouldn't just rest on your laurels that you're not in that highest risk age bracket.
Indeed. Well, a lot of people are speculating about this morning, so we're happy to have you on with your expert opinion, Doctor. I really appreciate you giving us the time.
No problem at all. Thank you.